Hello, I'm Juliette Tyson, Imani Village Mission Coordinator. And also I have another hat in which I wear once a year, which is the Imani Green Health Advocate Coordinator, as well as I'm also responsible to be the liaison to Trinity United Church for the program. Trinity's mission is inspired by Dr. Otis Moss III, mandates us to address the racial inequities that impact the quality of life in the African American community, especially the underserved. One major way to bring our mission to light is the development of Imani Village, a 23-acre model, urban, sustainable, green community based on wellness and wholeness, located at 95th and Cottage Grove on Chicago's South Side. How can this mission be accomplished? One, it could be accomplished from our board of directors, who are all experts in their field. And two, we are under the leadership of attorneys James Montgomery and Patricia Eggleston. The development of Imani Village includes working with like-minded individuals who believe in, one, the importance of environment and the health of its community members. The Imani Green Health Advocate partners are the Nature Conservancy, the University of Illinois at Chicago, UIC, Advocate Aurora Health, Chicago Regional Tree Initiative, the Modern Arboretum, Open Lands, the U.S. Forest Service. We will now have John Legge from Nature Conservancy, who will give you some more details about the Imani Green Health Advocate Program.
Good morning, and thank you, Juliette. My name is John Legge, and I'm the Chicago Conservation Director for the Nature Conservancy, and I'm going to talk briefly about some of the highlights and background of the Imani Green Health Advocates Program before we move into our main panel. And before jumping into this, I really want to give a shout out to the folks who really created the idea for the Imani Green Health Advocates Program, which includes Patricia Eggleston, the Imani Village Director, and Rachel Holmes, my Nature Conservancy colleague, who oversees our urban forestry programs around the US. And they really came together around this idea of how we could create a program centered at Imani Village that helped to bring together the interests at Imani Village in looking at community health and the needs of the community around health issues, and environmental health, and Imani Village's commitment to a green community, and how that could lead into helping young people with career opportunities in those areas, looking at that intersection. So this program has been under development for a few years, and we just finished up our third year in 2020. And I'd like to talk a little bit about several different aspects of it over the time period. When we started in 2018, we've always been committed to this intersection of community health and environmental health, especially thinking about the urban tree canopy and how much that affects the community with issues like asthma. And we at first thought that our participants, who are younger, early career folks age 18 to 25, that we would want them to go through as a single group and be exposed to both areas to really get that intersection. And that's what we did our first year, that sequentially they did conservation health, focusing on tree care topics, and then moved into community health. But one of the things we realized from that first year was that we really, if we wanted the folks in this program to be to leave the program with some skills and knowledge and training that they could use to take a next step in the area of greatest interest to them, that we really needed to give them more time to focus in one area. So from that time, we've modeled the program in having two cohorts, one focused on community health and one focused on environmental health, particularly tree care, but then interacting quite extensively through the program on shared projects and shared curriculum. Some of the parts of that shared curriculum have included grounding in the social determinants of health and understanding how those social determinants and environmental factors really contribute to health outcomes in the surrounding communities. And also in skills around community engagement, because the participants really get out and do a lot of connection with people in the community. And then finally, a component through Trinity United Church of Christ around healthy spirit, giving the participants, whatever their spiritual background, some tools to ground them in that part of health as well. So I'm going to talk a little bit about each of those two cohort models of the program. On the community health side, Advocate Aurora Health had played an especially large part in leading that team around the social determinants of health, and then also working on special projects like staffing their local food pharmacy that helps prescribe and donate healthy foods to people for dealing with chronic health conditions that are common in some of the surrounding neighborhoods. And also this past year with researching the disparate aspects of things like COVID and those impacts on the community, as well as special projects. On the conservation side, a big focus since the beginning has been the collection of tree health data for the US Forest Service. So our program participants have all worked to be trained and then collect this data about the health of trees in the surrounding community for things like insect pests and diseases, and as well as just gaps in the tree canopy. And so far, they've collected data on over 3,300 trees in the surrounding neighborhoods. This data has then fed into a community health needs assessment for Advocate Aurora Health for the surrounding area that pointed out the need for improvements in the tree canopy for respiratory and other health issues that are common there. And then finally, tree planting has been a big part of the program as well as an important skill set. The advocates, the participants in the program, whom we call advocates, have planted 80 trees so far. And starting in 2020, as you'll hear more about, we began a program with US Forest Service funding to help local residents replace dead and dying trees, which can be prohibitively expensive, and replace those with new trees to help maintain the existing tree canopy in those communities. So we've moved across this time span from a smaller program of 4 participants, whom we call advocates, because they're advocating for the health of the community, with 4 advocates over an 8-week period, and up to space for 8 advocates with a program leader. And this year, we added a second program leader to provide additional mentorship for the young people participating in the program. So that's a brief overview of the kind of scope and impact of the program. And at this point, we're going to introduce the panelists who will talk about the 2020 version of the Imani Green Health Advocates program at Imani Village. I'd like to welcome the rest of our panel to share the various perspectives for the remainder of our presentation. And we'll be kicked off by Melinda Harville, who is a community health worker 2 at Trinity Hospital, part of Advocate Aurora Healthcare. And Melinda will be sharing about the experience with the community health cohort of the 2020 Imani Green Health Advocates and the Advocate Aurora Healthcare partnership with the program. She'll be followed by Trinity Pierce, who is stewardship coordinator with the Chicago Region Trees Initiative. And Trinity will be kicking off the component around our conservation health cohort, talking about CRTI's collaboration with the program, and specifically the Tree Zillions tree planting and replacement partnership that was a big part of our 2020 program. She'll be followed by Forrest Cortes, who is Director of Community Engagement with the Nature Conservancy here in Chicago. And Forrest will be talking specifically about the community engagement approach and philosophy that our advocate team used in the program this year. And then finally, Harry Kuttner, who served as our program leader for the 2020 Imani Green Health Advocates program, will be sharing the details and successes about how the program worked in 2020 and some of the highlights of what happened. And then we'll come back for questions and answers.
Imani Green Health Advocates, February 27, 2021. Imani Green Health Advocacy, Community Health. What is a community health worker? Many people understand the term public health and is not so familiar with the term community health worker. They both work together where public health is the big umbrella in which community health falls underneath. Public health promotes and protects the health of people and the communities where they live, learn, work, and play. Public health works to track disease outbreak, prevent injuries, and shed light on why some of us are more likely to suffer from poor health than others. Public health speaks out for laws to promote for safer laws and spreading the word about ways to stay healthy and giving science-based solutions to problems. And we can all attest to the work that public health done during this COVID pandemic. A community health worker as a frontline public health worker who is typically a trusted member of a community in which they serve. This trusting relationship enables a community health worker to serve as a liaison, a link, an intermediary between health, social services, and the community to facilitate access to services to improve the quality and cultural competence of service delivery. A community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support advocacy. Advocate Aurora as a partner. As a partner with Imani Green Health Advocates, Advocate Aurora Health inspired to be a voice in the community to help educate and shape the minds of community members and young adults about the health and disparities and challenges in their neighborhoods. We can do this by working with Imani Village, offering job opportunities to learn and give young adults an opportunity to see how community health workers play a vital role in our communities. Milestones in community health for 2020. As milestones, Advocate Aurora Health underwent in 2020 to continue our partnership with IGHA, I would say was incredible under the circumstances we were faced with due to the COVID pandemic. We went from not being sure if we would be able to participate to having one of the most successful programs yet. The community health advocates worked virtually and in person. They were involved in community food distributions and giveaways, along with working with Trinity's food pharmacy programs, as our pictures depict here. More milestones for 2021 with our advocates. As a result, the success of the program in 2020, the community health advocates were successful in developing a Mindfulness Week program. This program addressed the mental health and well-being of members in the community, they highlighted the importance of self-care, physical health, mental health, with meditation sessions, yoga, and exercise. Other 2020 milestones, the community health advocates were involved in research on how COVID affected the areas in Imani Village and Trinity Hospital service areas. During their research, they were able to identify social determinants of health that made COVID that much worse in the African American neighborhoods. Social determinants of health that were identified were housing, wealth gaps, income, occupation, education, transportation, discrimination, and structural racism, healthcare access, resource utilization, and education. This picture depicts all about what community health workers do. Community health workers in the front line of in our communities, helping our communities in food pantries, health clinics, activities, healthcare. This is all what a community health worker does. And this is what our community health advocates were involved in our 2020 program.
The Chicago Region Trees Initiative, CRTI, is a partnership of leading organizations and agencies from across the 7-county metropolitan region, leveraging funding, knowledge, skills, and expertise to build a healthier, more diverse regional forest. With the support and guidance of our partners throughout the region, we recently launched our 2050 Master Plan, designed to coincide with and support stakeholder needs, goals, and strategies. Our goals include inspiring people to value trees, increasing the Chicago region's tree canopy, reducing threats to trees, and enhancing oak ecosystems. The 4 outcomes for each of the goals include improved tree health, improved urban forest policy, increased funding for urban forestry, and integration of science. More specifically, in terms of tree canopy improvement, we aim to increase the Chicago region canopy by 4%. By the numbers, that means growing our urban forest by a whopping 26 million more trees. We cannot accomplish this feat without community engagement to understand, respect, and support existing local work and needs. Therefore, our outreach focuses on inspiring people to value trees as well as planting trees. Detailed community research, including socioeconomic and human health data analysis, ensures we recognize each community's unique heritage and character. These healthy eating murals are an excellent example of a local school art project that inspired our tree plantings, including fruit trees to expand the school garden. We then partnered again with the school to plant trees the following year, with students taking the lead in watering the new trees. The Tree Zillions program is a creative public-private multi-sector partnership focused on assessment of the current ash trees population using the Nature Conservancy's Healthy Trees, Healthy Cities app, performing trees removal and site preparation with workforce development and on-site training, and implementing community-based replanting with stewardship education. The program supports communities facing significant canopy loss, as well as existing inequitable access to tree canopy. Our priority is to equitably redistribute resources to help communities proactively restore their canopy and support community leaders in advocacy for green infrastructure, e.g. trees. From my perspective, what makes the Tree Zillions program impactful is the wonderfully diverse collaborators at the table. USDA Forest Service, Trinity United Church of Christ, Imani Village LLC, Advocate Trinity Hospital, the Chicago Region Trees Initiative, the Morton Arboretum, University of Illinois at Chicago, and the Nature Conservancy in Chicago all encouraged effective storytelling of the community restoration through non-traditional methods like faith-based narratives, arts, and celebration. Furthermore, the strong collaborative framework of the Tree Zillions program has made for a dynamic model that can be replicated nationwide. The Chicago Region Trees Initiative was able to support the Imani Green Health Advocates program by providing trees this past fall through funding from the Great Lakes Restoration Initiative, a program launched in 2010 to protect and restore the chemical, physical, and biological integrity of the Great Lakes Basin. The excellent timing of these shared resources and partnerships made this community-based project even more effective and sustainable. Through Tree Zillions, we are engaging young emerging professionals in arboriculture, fieldwork, and providing potential employment opportunities in their communities. We look forward to continuing to work with the Nature Conservancy and the Imani Green Health Advocates in 2021 and beyond. Thank you.
So I'm going to share a little bit about the community engagement aspect of the program. And you all have heard a little bit about this and how it's been kind of intertwined through all of the aspects of the program from my colleagues. But first, going back to the start of the program, it's important to acknowledge that even in its earliest ideation, this program originated from dialogue and brainstorming, an organization deeply rooted in the communities the program is intended to serve. Because of what we learned in these conversations, we knew that we needed to develop a program that was paid and that would help provide jobs and career training in the service communities that we were approaching. So we focused workforce development and recruitment primarily on neighborhoods within the service area. We also knew that there were financial barriers to tree care, tree removal, and tree replacement across these communities. So that was woven into the program as well. You heard a bit about the role of community engagement from the health side of the program from Melinda. This was also a really big focus of the conservation curriculum development and refinement. Community engagement was a key component, and the learnings and practice around engagement has evolved with the program. As we implement each year, we refine our curriculum based on what we're learning, not only as program organizers, but also from our program participants and what they learn while working in the community. In many ways, there are eyes and ears on the ground in these communities where we're spending time. Up front, we may have underestimated the need for basic relationship building with the community. In these times, it's rare and maybe more than a bit disconcerting to have a stranger knock on your door. We're so used to just virtual messaging and phone calls and Zoom webinars, but the backing and reputation of helped to open many doors, pun intended, and the responsibility lay with our advocates and program leaders to build trust and create a dialogue that encouraged residents to connect with the program. To prepare our advocates for this aspect of their work, we held a number of workshops on community engagement, including guest presentations from experts in the field. By expanding the advocates' exposure to a range of topics in this discipline, we help them to see that while community engagement skills start with our innate ability to connect with others, they must be intentionally practiced and refined in order to achieve impact. The time that the conservation health advocates spent out in the community was really precious, and they used it to get to know the residents who participated in the program and engaged residents in dialogue to understand their needs relative to trees on their own property. After a few initial conversations with the residents, it was clear that the scope of Tree Zillions needed to be expanded from what we'd originally expected, just removal and replacement of dead or dying trees, to include pruning. And where flyers might have failed, conversation prevailed, and the advocates were able to have honest dialogue with some residents who wanted trees removed, but who didn't want replacements. By making the connections between human health and healthy tree canopy, and by listening intentionally and proposing solutions to the concerns that residents raised, the advocates were able to encourage many of the initially hesitant property owners to replace the removed trees. On the picture on the left, you'll see one of my favorite memories from the 2020 program, which was at a community tree planting demo. So we wanted to show folks like what goes into removing dead and dying trees and then replacing them. And we had a few community members show up, and one of those community members came over and struck up a conversation with me. And he started talking about how he was at first very hesitant to put a new tree on his property, worried about any number of things associated with, the trees and the care of the trees, but how after talking with the residents or talking with the advocates, he became really excited about getting a new tree. And to me, this spoke volumes about the impact the advocates had. He was telling me about the benefits of trees to people. It wasn't the promise of free trees that led to resident participation. It was the time that the advocates spent in dialogue, building a foundation of understanding. To carry forward the start to relationship building, we are looking forward to adding capacity this spring to work with residents on tree stewardship and ensure that residents feel supported and that the trees flourish over the coming years. Overall, an approach that's centered on delivering a completely fixed set of services or educational programs would have limited our impact, where an approach built on dialogue with built-in flexibility based on what we heard from residents in the field has led to much better results. The participation of a community-oriented organization has really helped to ensure that we stay attuned to the shifting needs and realities experienced by the communities in which we're working. Too often, organizations think of their programs as a one-way street to provide services and benefits to communities. What we don't realize or acknowledge is that our program should in fact be a two-way street where we are listening, learning, and adapting based on what we experience with communities. If we get too far from spending time on the ground with partners and residents, we risk losing relevancy and also hamper our efforts to maximize the impact of our work. With the Imani Green Health Advocates program and in so many other aspects of our urban conservation work, it's important to remember that we are working in the backyards or down the block from people who have lived in these communities long before we arrived. You can see that in the photo on the right, where the advocates are working right in front of someone's house, right by their cars, right where people are walking their dogs. And while it may seem that thorough community engagement adds to project timelines and budgets, it's important to note that in urban areas, responsible engagement ensures better depth and longevity of conservation impact. We saw this firsthand in our program, thanks to the commitment of our partners, our program leaders, and the advocates to this aspect of our work. I, for one, would be proud to have the Imani Green Health Advocates working in my backyard any day.
Thanks, Forrest. I'm going to discuss some of the program highlights from the past year. Our advocates were broken up into two cohorts, a community health cohort and a conservation cohort. While they spent the majority of the 12-week program working in their separate fields, we built in a certain degree of shared time for collaborative learning, discussions, and advocacy work. The program started with a shared week designed to orient our advocates and provide a basic introduction to some of the social determinants of health, which Melinda has mentioned previously. With the help of Dr. Angela Odoms-Young, our partner from the UIC Kinesiology and Nutrition Department, our advocates explored some of the basic concepts of community health and the various social factors that impact the health of a community. Through discussions with guest speakers, community leaders, and program partners, our advocates explored some of the specific factors that impact the health of communities on Chicago's Southeast Side. For most of our advocates, this was the first time that they had considered the complexities of what impacts the health of their communities. The goal of this first week was to begin to build a sense of community amongst our advocates and partners so that they could be successful throughout the remainder of the program. Thanks in large part to my co-program leader, Kareem Abbas, we were able to continue developing this team cohesion throughout the remainder of the program through activities focused on self-reflection, mindfulness, and sharing of one's personal lived experiences. Cross-cohort work also continued throughout the remainder of the program, taking place every Friday when all advocates would gather together to reflect on the week, either at Imani Village or virtually. As program leaders, we structured Fridays around mentorship activities, peer learning, and mindfulness activities. As you can see in this photo, this is our team during the first week practicing socially distanced yoga on the campus of Chicago State University, which is right next to Imani Village headquarters. Each Friday also featured a guest speaker from the community, a Chicago-based nonprofit, or one of IGHA's partner organizations. These speakers would share the community health or environmentally focused work that they were dedicated to, as well as expand on their personal career paths. This way, our advocates were able to explore in depth some of the many facets of community health while putting to use their career networking skills. Midway through the program, we had a second shared week where advocates began planning their final projects for the program. The 2020 advocates chose to produce a series of virtual engagement and learning opportunities that were open to the public. These virtual programs range from a discussion on the connection between the urban canopy and rates of asthma to a film screening and discussion of the Lorax. The overall programming was entitled "You Are Where You Live." Each cohort also produced a final report on their work and research throughout the 2020 program. The community health cohort produced a report on the impacts of COVID-19 on the Southeast Side, and the conservation cohort produced a report on the general health of the urban tree canopy within the 8th, 9th, and 21st wards. These reports were shared with the program partners and Imani Village leadership, who in turn have used some of this information in their community building efforts. Next, I'd like to provide some of the conservation specific highlights of the 2020 IGHA season. So the conservation cohort was focused on advocacy related to the health of trees in the communities that we served. In the first couple of weeks of the program, our advocates were trained in some of the basics of arboriculture, such as tree ID, tree biology, and pest and stressor detection. They also participated in the Chicago Region Trees Initiative Urban Forestry Basic Training. Once they received some of these initial trainings, they began 5 weeks of tree health monitoring using the Healthy Trees, Healthy Cities application. So the team ended up being able to survey 958 public street trees for general stressors and pest detection. So during that time, the advocates would actually be walking half-mile plots across our 3 different wards. So up and down different blocks looking at Parkway street trees. During this time, they also began to conduct community outreach for the Tree Zillions tree removal and replacement program. The second half of the 2020 program was focused on conducting community outreach and residential site visits for the Tree Zillions program. During these site visits, advocates would conduct tree health assessments, looking for evidence of disease or insect damage on resident trees. Advocates learned how to survey a site and produce a general site map and assessment for Davy Tree Experts, our contractor partner who conducted removals and prunings for the Tree Zillions program. Advocates would speak with residents about their trees, trying to highlight the benefits of trees and the advantages of replanting on their property. In the pilot year of the Tree Zillions program, our advocates connected with 34 residents who expressed concerns about the health of their trees on their property. They surveyed over 50 trees on residential properties, as many of these residents had multiple trees on their lots. 19 of the trees that we surveyed have already been removed by Davy Tree Experts, and 1 tree has been pruned so far. The 2020 conservation advocates also planted 30 trees across the city's southeast side, which we received through the Chicago Region Trees Initiative. 9 of those trees were planted on residential properties in the 8th, 9th, 21st, and 34th wards. During those plantings, our advocates would guide residents through the planting process and provide information on how to care for their trees going forward. Finally, our team also held 2 community plantings. The first was at Imani Village, where a removal and replanting demonstration served as a community outreach opportunity. So as Forrest mentioned, this was a chance for interested residents to see our team in action and speak with the advocates about tree zillions. That event in particular really provided an opportunity for any residents who are on the fence or hesitant to participate to see our team doing, responsible tree planting and ask them questions that they had. The second planting, community planting, which is pictured above, was at Palmer Park, which is in the 9th ward, and provided an opportunity for our advocates to connect with Chicago Park District employees from the Forestry and Natural Areas Department. Thank you.
Now I'd like to ask John to turn on his camera and mic, and we have time for some Q&A. There's some great questions that have come in the chat already. And one thing that came up and was answered in the chat, but I would love it if John, perhaps you and some of the other panelists could speak to it, for the recorded version of the session. There was a question about gentrification concerns in greening programs with this program. So I was hoping you might be able to say a few words.
Yeah, sure. Thanks, Brandon. So yeah, there was a question in the chat from James McGee about any potential concerns about the work we're doing leading to higher rent prices and gentrification, potentially driving out the folks living in the communities right now. And that's always a question, working on natural infrastructure and that kind of thing. And I think, as Forrest really described our community engagement work, all of the improvements we're making are really at the request of individual homeowners, or pretty widely dispersed at some park sites and that kind of thing, and does not seem to be like the kind of thing where based on my understanding of kind of the impacts of gentrification, is not something I think we're leading to that kind of concern at this point. But I think that is a question we need to keep asking ourselves, and hopefully having that connection with folks in the community will help there. I don't know if Forrest, if you're able to join, and if you wanted to add a few words about that, that would be great as well. And I wonder if Trinity could join as well for one of the other questions. Forrest, do you want to say anything more about that?
Yeah, can you all hear me all right? Okay. Yeah, I would just add that, it's not something to be taken lightly, and it's something that we hear in a lot of aspects of our urban conservation work, and I'm sure is something that folks hear in a lot of places. One thing that was really important for us was working with partners who are also working within the community and who have strong ties on the ground, because kind of as John was alluding, partnerships with the community residents, partnerships with community-based organizations, we're making sure to stay in close communication with them, and that the improvements we're making are benefiting their constituents, the residents who currently live there, and not bringing in our perspective of what we think the area should look like, or what we think, future residents would like the area to look like, but really addressing current resident concerns and current organizational priorities for community-based organizations.
Thanks, Forrest. I was also going to note one of the other questions in the that came through in the chat. Trinity, this might be a good one for you to respond to. Kathleen Garnis asked about the trees that the program plants and if they're all native, and those came through CRTI. So
yes, and I did answer in the chat, but that is a focus of ours where possible, not just native trees, but species diversity. So we were able to plant some oaks, as well as in the case of the Princeton elm, a cultivar of a native, that we're able to get those elms back in the community. So very excited that the innovation that we're seeing in nurseries and locally and in the region ensures that we are able to plant diversity of species, moving beyond maples, because that is so dominant. It's just an exciting time to be involved in urban forestry. But again, just as Forrest and John are saying, with that community, local leadership spearheading the way.
Thanks, Trinity. And there's also a question from James McGee in here that Harry and Trinity might both have something to say about, saying that arboriculture pays well, but the work can be dangerous. And so what's been put in place to keep participants safe?
Yeah, sure. I can address that a little bit. So yeah, I would say with our program, our advocates were really doing street tree monitoring, from the ground on the sidewalk, walking around the tree, using a DBH tape, looking for exit holes, stuff like that. And then they're planting trees, which I'd say the largest tree we had was like maybe 10 feet tall. They're all potted trees, containerized trees from nurseries. So they're not getting into any removal work. All of the removal work is happening. Removal and pruning is happening from our partners at Davy Tree Experts. Yeah, so they're not really put in a dangerous arboriculture situation, to be honest.
Well, I would add that, for instance, I'm a certified arborist, and it's such a vital set of tools to have for my stewardship work in the urban forest. But there's so much you can do to care for trees with your feet firmly on the ground. So happy to talk more offline about that. But I like that we're not all of us tree climbers. You would not find me 30 feet up in a tree, as beautiful as they are. So really appreciate the variety in arboriculture.
And thanks, Trinity and Harry. And I would just point out our colleague Rachel Holmes, who's also with Nature Conservancy, and mentioned is in the chat that about our partnership with Davey. I have noticed in some of the pictures of some heavy equipment taking down some trees. That was part of the tree replacement and program, taking down some dead trees. And the Davey folks really did the dangerous stuff with that part, with our advocates standing at a safe distance. Let's see. There was a question about from Kathleen Fitzgerald about advocates participating in the Tree Keepers program. And Open Lands did participate with us in some of the training that the tree keepers or that the advocates received. And in fact, I was in the tree keepers class this past fall, and I know one of our advocates was in there with me. So I think there was some. Harry, were you going to say something?
Yeah, well, yeah, I would just wanted to add, it wasn't built into the program, participation in tree keepers, but Al from Open Lands gave a presentation to our advocates about the program, and it was a career networking opportunity as well. And then one of our advocates, as John said, Hannah, was able to participate in the Tree Keepers program in the evenings, and I think she received a scholarship from Open Lands to participate in that for free.
We're running a little short on time, but I'd love to, John, if it's okay to hear sort of from each of our panelists, and I want to bring Melinda on too, to hear a little bit about sort of what you're looking forward to with the future of the program, this year, next year, and in the coming years. So I guess maybe we can start with whoever would like to begin.
Sure. Well, since I'm the only one with my mic on, I'll start. I guess I would just say we've been learning and developing the program a little bit more each year. I think this year it felt, especially with the tree replacement program, it felt like we really deepened a lot of connections that I think we can build on in the community, and I'm excited about seeing how that continues this coming year. Who else would like to say something?
I can jump in. I would just kind of second that. I think keeping in touch with the residents we've already connected with and making sure that they have everything they need to take care of their trees and to continue to be advocates for the relationship between trees and building a healthy community. I'm also really excited. This past cohort, Melinda can probably speak to this too, really focused on mindfulness a lot and focused on kind of healthy personal living for our advocates. And so I'm really excited to see that aspect continue in our next cohort of advocates, and really providing that space for them to, build a team feeling and also build themselves, outside of just the hard skills that they're learning around these career fields.
Go for it, Trinity.
Thanks, Eric. I'd just say Chicago Region Trees Initiative, very excited, honored to continue working to support the next cohort. And we are on board to provide them trees this coming fall as well. So very excited to keep that investment local.
Yeah, and the one thing I'll just say real quick is I think this being the first pilot year for the Tree Zillions program, going into next season, I think if some of the, community members having seen removals actually happening and replacements happening, there's going to be a lot more trust built in for the next season. And I think the next round of advocates can really build on that community engagement and trust building.
And I am most excited to bring back the advocates again to further build the community health worker and community health work side of our community conservatory program that we're doing now, because as you know, that this pandemic that we have been faced with, that work became very prevalent in our community. And that showed the value just of community health workers, how important they are in our communities and educating our constituents that live in our communities about our health and social determinants of health, addressing all of those needs and the resources that our communities need. So I am looking forward to having the startup of a new cohort to continue the work that we are already doing and to help build our communities.